Hey guys, it's me, John Anthony Chihak Soltero. I am the anti-hero, and I'm here with kind of just a, I don't know, news update or what have you. So amid everything that's going on in the country, in the world, in my hometown, um, last Wednesday after a workout, I began to feel like a chafing and a pulling uh, on what felt like my right bicep, like the very top of the bicep when it connects into the armpit. And fortunately, investigated it, took a look, and there was a very large lump. And now I have a bandage over it. The lump was like if you took a hard boiled egg and cut it in half a golf ball, something pretty good sized lump. And then the very next day, I did kind of a comparison to the tissue on my other armpit, and the rest of the tissue was inflamed and pushed out, but you could still see the lump very clearly. Um, and I have a history of cancer, lymphoma specifically. It did manifest itself as bone cancer, um, but as with most cancers, it's always in the back of your mind and you always think about that kind of stuff. So aches and pains that don't go away after a couple of days or, massive fatigue or what have you, um, are things that you need to take seriously. So, got it taken care of today. Everything's good. Um, very next day in the morning, I called my doctor's office. Could not get an appointment because of everything that's going on. They're trying to push everybody not to come into the doctor's offices. Um, but I really pushed for myself because I have a health history with this, and it's very important that I be seen. I wasn't rude. I know what these medical professionals have to be going through right now, but at the same time, I wasn't going to be, denied being seen by a medical professional. The following day, um, I called back because they told me I had an appointment or like at least a telephonic appointment. Um, the doctor again couldn't see me. I actually got to talk to her on the phone and said, "So this is what I want you to do. I'm putting in a referral for general surgery based on what you're saying. It does need to be seen. Um, Based on your history, it absolutely needs to be taken care of. But if you can't get an appointment in the next day or two, I want you to go to urgent care." So I tried calling the surgery department. They couldn't confirm whether or not I had the appointment yet or not. It was just too soon. So I left work. I went to urgent care. Fortunately, there was nobody there. There was like one person who was already in an exam room, but nobody else was there. It was really kind of crazy. Um, so I was in and out within about an hour's time. Antibiotics, just told to follow up, with the surgery department. I get home probably around 2:30. I get a call from general surgery at Banner Health here in Tucson, and had an appointment for today at 10:15. Today is Monday. Um, and so everything was going good. I felt good about it. Pushing for myself to get that help. And then Sunday night is when all the anxiety kicked in, thinking like, what if this is cancer again? What if this is my lymph node needs to be surgically removed? Telling myself that everything was going to be okay was one thing, and telling my family everything was going to be okay was one thing. But dealing with that when you're kind of in isolation, I mean, you're still working and everything, but it's very tough. So went in this morning, got right in as well. Doctor came in, took a look at it, examined it, said it's a boil. It needs to be cut and drained. We did that right there in the office. That's why it's bandaged up. right now. Um, Said there should be no repercussions from it. There's nothing I did. There's nothing that could have been done to prevent it or can be done to prevent it in the future. Essentially, an oil gland got clogged up. And normally speaking, when that happens, it's got like a black head on it. So if you see lumps starting to protrude on you and they look like almost like a mouse, if you ever watch boxing or MMA, when somebody gets punched, especially right below the eye, there's that lump and it kind of moves around a little bit. That's a mouse. That's essentially what this looked like, except it was really big. Um, there's usually a head on it, and that's the point where they can drain it. That's actually the clogged pore, or the clogged gland. Um, they could not find that on this, so they went in and they cut into the mass itself and drained it out. Um, the smile and the relief that I had on my face when the doctor said that was probably pretty classic. But everything's good. But I just wanted this to be maybe a teaching moment, even in light of everything that's going on. If you are having a major health issue or you have a health history with something that you're seeing symptoms of, ask your doctor to get checked out. Ask your doctor to get checked out and make sure you let them know about your medical history. Sometimes they don't have the chart with them and they don't know that. It may be a brand new doctor, but it's important. Even amidst a worldwide health issue, your individual health is really important. And so this is kind of my PSA. Like even during this time frame, you need to take care of you, um, while we're taking care of each other. Because if something happens to you, who's going to take care of those who depend on you, those who care about you? So that's just my anti-hero PSA for right now. Um, there will be more comic book and Bubble Patrol update videos coming soon. Um, and I'm also going to be running, like I said, shows on my Anti-Hero Brand Press Facebook page on Saturdays at 7 p.m. Mountain Standard. Um, so it's business as usual for me. I'm not changing anything up, and trying to keep this as normal as possible. So hope you guys all have a wonderful week. Take time for yourselves and take care of yourselves. Stay anti-hero strong.